Hey, this is Doug Field along with my co-host Ron Bachman, and welcome back to the segment of Healthcare Consumerism Radio. You know, you can't have healthcare consumerism without really including the critical decision support tools necessary to help that consumer make the right choice for care at the right price. And joining us today is Steve Eno, VP of Marketing at WiserTogether, one of the leaders in this space. Good morning, Steve.
Good morning. How are you doing today in Atlanta?
Great. Good to have you here. Where are you today?
I'm in snowy and cold Connecticut.
I thought you were. I thought that's where you were. I didn't mean to set you up like that, Steve.
That's okay. You know, it's the joy of living in the Northeast.
Steve, for our audience, obviously you're WiserTogether, and you and Praveen and the group are friends of the Institute. And you've supported us, and we've supported you, and we really like what you guys do. But for those that may not know about WiserTogether, give our audience a snapshot of WiserTogether's position in this space.
Sure. We do play in, as you said, that decision support market. But we don't focus on price, which is where a lot of employers go first. We focus on what we call care transparency. And to put it quite simply, our mission is to help patients, employees, plan members, dependents, to choose the right treatment for them. It's great if someone can find the best place to get carpal tunnel surgery done by using a price transparency tool. But what if carpal tunnel surgery isn't actually the best thing for that patient? Mm-hmm. So our product and our website is really dedicated to helping a patient understand their treatment options, and through some pretty unique personalization tools we have, help that patient figure out what the best treatment options for them personally based on their specific preferences and health situation.
Steve, that's a great concept. But as you know, the most trusted relationship is between a patient and their physician. So if the physician is recommending something and you give all these options and choices through a website to the patient, how do you get them to ask their physician about the alternatives? Do you suggest they go get a second opinion? How do you move the patient towards that more ideal care treatment that your system may be recommending?
Yeah, I mean, and the last thing, to be perfectly honest, we want to do is get between the patient and the doctor. Mm-hmm. We want to help facilitate a better discussion mm-hmm. between the patient and the doctor. In our current system, as you know, and everybody on listening to this knows, we don't pay doctors to spend as much time as they really should be doing
right.
With their patients.
Right.
So, so the doctor, they're time limited because, again, they're not paid for it. So they don't have the opportunity to talk to the patient about their preferences and talk to the patient about all the options. So inevitably, what we all do when we walk out of a doctor's office is we do web searches and we talk to friends, et cetera. Mm-hmm. On Wiser, we pull all that together in one place, and the information is curated. So by going through our tool, rather than having things from a random internet search, we provide both questions to ask their doctor about their condition and the treatment, but also the 2 or 3 treatment options that, based on what they told us, are going to be the best fit for them. Mm-hmm. And we encourage the patient to go and talk to their doctor and say, you recommended I do X, or we're here to talk about what path I should go down. Here's 2 or 3 things that, I'd like for us to talk about, and let's you and I have a dialogue about what the best fit for me is and what you think is going to work the best for me. So we've, again, we want to facilitate that conversation with the doctor and make it more productive and valuable for both the doctor and the patient. That is so needed because patients don't know the right questions to ask. So I think you're in a fantastic space there. Now, as I look through some of the profiling of this service that you have, you talk about the patients making these choices and giving them information around the patient demographics, the lifestyle, personal preferences, and even their financial situation. How does that all come together in the profiling that you do? You sort of describe it
as sort of like an eHarmony type of an approach where you're looking at each individual's preferences and their whole profile.
Yeah, we start with what we call a strong match for a typical patient, and that is based. And the core of all of this is patient surveys we have done. We survey both patients who've had specific conditions as well as doctors who have had a condition. Not a doctor who treats carpal tunnel, but a doctor who's had carpal tunnel. And over the last 2 years, we've collected 4 million different data points on how someone judges the effectiveness of their treatment. Did they like the experience with that treatment? What are their demographics? What are their preferences? And we pull all that together to create a strong match for a typical patient. And, of course, we use clinical evidence as well, and that's clearly displayed on the tool. But through a series of questions, the patient can personalize that strong match, basically change that rank order. And the things that we ask about, it's the comorbidities, what treatments have you tried in the past, or what treatments would you consider? Are side effects, the risk of side effects important? Is cost important? All of those things that a patient should be thinking about before they decide to have surgery or try a home remedy or fill a prescription at the drugstore.
Steve, go ahead, Steve. I'm sorry.
And the interface is very visual. It's literally a bullseye, like for bow and arrow you've seen, right? And the bubbles, and each bubble represents a treatment choice. We'll move in and out of that bullseye based on what the patient is telling our tool.
Is this tool accessible on smartphones, Steve? Is that the smart mode?
Our website is accessible on smartphones. The bullseye in that interaction is a lot more difficult to execute on a smartphone. It's just that landscape is just not big enough for it to be effective.
Okay.
For tablets and for PCs and for Macs, it's great.
Okay.
Smartphones, again, you've got that much smaller space. It's really hard for the user to interact with it.
Okay. So for our audience, who are your clients? Do you go after large groups, small groups, fully insured, self-insured? You go through insurance companies? What's your market?
We currently target both employers and health plans, primarily self-insured, right? Because that's the employer who's got more skin in the game from a cost perspective. We target 5,000 employees and up. But we definitely have solution and pricing that will work for smaller employers as well. And we have clients that range from 150 employees up above, and then to over 50,000.
Steve, what are the results to date from both the consumers that have used your tool and then the employers and health plans seeing the results of their employee consumers using the tool?
Yeah, we see employee engagement, and we count engagement not as just someone looking at the site, but someone actually investigating a condition and their treatment options. And that engagement is 30 to 65% of employees who had a medical claim for something that we cover. Right, so it doesn't include people who had no claims at all, but if we look at people who had musculoskeletal issues, cardiovascular, maternity, any of the things that we cover, we see 1/3 to 2/3 of those patients coming to our tool to learn more about their condition and their treatment options. And then we also see, based on post-usage surveys, that 83% of our users said they were able to choose a more effective treatment, and 86% of them would recommend our tool to their friends and colleagues. And one last thing from a results perspective, our ROI, we return investment to our clients based on a reduction in ineffective tests and treatments, and we've seen that reduction to be about 25%.
So your business model is what? You charge per member per month. You get a percentage of the premium. You get a percentage of savings. What's your business model?
We charge on a per employee per month basis with a relatively nominal implementation fee, and the implementation fee It's really just to cover our costs to get someone started. But after that, it's a PEPM model.
How do you see, Steve, how do you see you playing in the emerging private exchange market, with your tool?
Yeah, to be honest, we're not playing there yet.
Mm-hmm.
We think that we'd be a very good fit as an add-on to when someone is buying, whether it's a high deductible plan or a PPO plan. So that's one way for us to get into that market. The other way is for and we're talking to insurance plans now about adding us to their book of business tools.
So that's a good option.
Right.
If you're trying to reach, say, the smaller employer market, if you have a book of business for an insurance company, you could add your service to a lot of small groups and give them the same access that you give to some of your very large, well-recognized names.
Exactly, and we would be able to get that through the private exchange as well.
Mm-hmm.
Let's see. Steve, we got about a minute to go, and I want to give you a good chance to leave our audience with a few takeaways.
Yeah, I think that, as, you're thinking about consumerism and transparency, price is great, and we need to make sure that people understand what something costs. But even before they get to pricing something, they need to understand whether that treatment is actually going to work for them. Because, just because you got the great price for something doesn't mean you actually needed to spend that money in the first place. Right. And, our research and a lot of different medical studies say that the better match a treatment is for a person's individual needs and preferences, the more effective it's going to be. And I'll just give you one more example to sign off. So if you think about high blood pressure, most people would think that a great way to lower your high blood pressure is to exercise and eat better. But if you go down that path without recognizing that you're just too busy or you're not one of those people who's actually going to exercise, it's not going to work for you.
Right.
So again, that's just a really simple example of why understanding and matching someone's preferences with their treatment option is so important, and ultimately will save both the patient and their employer both time and money.
Thank you, Steve. I appreciate you joining us on this segment. You have a great weekend up in Connecticut. And to our audience, you can visit with Steve and the rest of the WiserTogether team at our May Forum, May 7th through 9th in Atlanta. Take care, and we'll see you on the next segment, Healthcare Consumers and Radio.